Hi, welcome to Young at Heart. I'm Tammy Murray, your host, and today I'm really excited to be turning the microphone over to Anna Kelley, who is our Shine Coordinator at the Kingston Council on Aging, for a short series of shows that we're calling Inside Health Insurance. So thank you for joining, and take it away, Anna.
Hello, my name is Anna Kelley. I'm the Shine Counselor at the Kingston Council of Aging. I'm at the Kingston Council of Aging every Tuesday, and also during open enrollment, I'm there every Tuesday and Wednesday. I wanted to talk to you today about Shine and what we do. Shine is a program that's sponsored by both the federal and state insurance agency, which provides information for health insurance information for individuals of pretty much any age. It's geared towards seniors, but people of any age can come and obtain the information. SHINE stands for Serving Health Insurance Information Needs of Everyone. And it's a program put on by the state. Here in Massachusetts, we call it SHINE. In other states, they call it SHIP or any other acronym. During open enrollment every year, seniors and anybody who's on Medicare has an opportunity to evaluate their portfolio of insurance to determine if there's maybe a reason to change. Open enrollment at this time is October 15th to December 7th. You'll find that most senior centers will have a director of SHINE coming in to put on a briefing about what information you might want to know about things that are changing with the various plans that are being offered through Medicare, and answer any of your questions. At the Kingston Senior Center, we plan to have the regional director visiting on November 9th at 10:30. You can call the Senior Center at 781-585-0511 to reserve your seat, and you'll be able to learn a lot about what's going on with Medicare, what changes are coming about this year. So again, that's 781-585-0511 to reserve your seat for the open enrollment discussion. If you can't make it during that time, that's okay. I'll be here to help you at the Kingston Senior Center. And you may want to know what kinds of things could we do for you. Well, during open enrollment, I can look up your current insurance coverage. I can look at what the plan changes are for next year. For example, you may have received something in the mail from your current drug plan or Advantage plan. They may talk about some changes that are going to take place. Perhaps there's a change in the premium price. If that's the case, and you think you might want to go with a less expensive plan, or if the plan hasn't really met your needs through the year, you can come in and talk to us, make an appointment at the same number I gave you, and we'll evaluate your current coverage, and we'll perhaps offer other options for you. We can evaluate other plans. We can do a printout of comparative information. If you're ready to decide right then and there, we can enroll you in another plan. If you want to go home and think about it, you can do that, and you can come back, or we can make a phone appointment, and we can enroll you in a different plan at that point. Just remember, when you make your appointment, you want to bring all of your insurance cards. You want to bring your Medicare card, which has all of the information that we're going to need, and a list of your medications. Why do we want to know about your medications? Well, all of the drug plans and the Advantage plans rank your medications into tiers. You may have heard this term before. Tier 1 is generally the least expensive, mostly generic drugs. Tier 2 may be a generic but a little bit more expensive. Tier 3 may be a brand name. Tier 4 may be a specialty drug. Some plans even offer 5 tiers. Just because your plan has your drugs in certain tiers doesn't mean the other plan will have the same exact tiers. So, for example, atenolol, which is a high blood pressure medicine, that can be a tier 1 in my plan, but it can be a tier 2 in another plan. That matters because that's how the pricing structure works. Usually tier 1, you can find plans that offer tier 1 medications for $0, $1, $3. And when you get to the higher tiers, they're usually a percentage of the retail cost. For example, it could be 33% of the retail cost. So come and talk to us during open enrollment if you can, and if you don't want to, you may ask yourself, what does the Shine person do during the rest of the year? Well, believe me, I do keep busy because it turns out insurance is complicated. And it's very complicated when you're getting letters from insurance company offering you things and you want to know, is this really true? Can I get a plan for $0? Well, I can help you with that. I'll give you some examples of some of the things that I do during the year. Sometimes people call the office, they're new to Medicare, they just don't know what to do. Maybe they're just about to retire and they want to know, what advice do you have? For these people, I would give them the advice that there's Medicare A and B, and before you retire, you want to go to the Social Security office and tell them your date of retirement. And you'll have to make a decision about whether you want to enroll in Part A and B or just A. I'll go into the different parts of Medicare at a different session, but typically A is premium free for people who have enough work credits, premium, and B, and it covers hospitals. B has a premium. Currently the premium is $104.90 in 2015 for current people on Social Security. However, if you've been reading the newspapers, you may have heard that the premium will be going up for new retirees next year. What else could I do? Well, what if sometimes somebody comes into the office and tells me, I've never paid into Social Security. How can I get my health insurance coverage? I can help with that. First question I would ask is, do you have a spouse or an ex-spouse that paid into Social Security? If so, perhaps you could enroll in Medicare through your spouse's earnings. Here's another situation. A person comes in, they just talked to their neighbor, and their neighbor told them that they heard about a new plan that offers 0 premium. Well, come on into the office. Let's find out if that's for you. Sometimes that 0 premium may have other costs that you're not willing to live with, because insurance is all about cost sharing. So if you have a 0 premium, you're going to either pay now or you're going to pay later. It may be that you're going to pay later with the 0 premium. You don't pay much during the monthly premium time, but you will pay more in the out-of-pocket time. Let's say that you forgot to sign up for drug plans. You're a Medicare recipient, you have A and B, you never signed up for a drug plan because you never needed drugs. Well, the sad news is there is a penalty if you sign up late. I can help you with that. Also, there are certain periods of time that you can sign up. I can help you with that. Or you're not happy with the current coverage that you have. Well, come on in and we'll see if there's a way that we can get a special enrollment period and we can get around the limitations that are currently in place. sometimes you may be diagnosed with a certain illness that might require some specialty drugs that are very exorbitant. There are programs that the Shine person has information about that might be able to help you with these extra costs. Also, if your financial situation has changed and you can no longer afford your current situation, make an appointment to come see me or your Shine person, because we have access to all the most up-to-date information about financial benefits that are available either through state or federal or even private programs. So make sure that you bring in whatever information that you have. And I want to make sure that you understand that when you come and make an appointment with the Shine counselor, we will keep all of your information strictly confidential. A lot of people I see in the Kingston office are not from Kingston at all. Why? Well, they don't want to go to their local senior center because those people know them. Be assured that regardless of where you go, your information will be held in the strictest confidentiality. So throughout the year, I want you to know that your Shine counselor is available to provide information about all of your insurance options. They'll also be able to help you with prescription drug coverage, help you with insurance information that you may be receiving through the mail, like, for example, something was denied, coverage for an event was denied, you went into a nursing home and your bill wasn't paid by Medicare. I can help you get to the bottom of it, because sometimes the information that you receive from an insurance company may not be easily understandable. So please make sure that you understand that we're available to you by appointment, and if you have any questions, make an appointment with your Shine counselor, and we'd be happy to help you. Thank you.